Many people throughout the United States have heard about the healthcare system that the government just cannot wrap around their head. There have been debates and conversations stating that the people of the United States should not pay large amounts of money to keep themselves and their family happy and healthy. But on the other hand, many oppose this due to the expenses and the limitations of having a universal healthcare system. Unlike the US, many Europeans have already set foot and obtained the concept of a universal healthcare system, but this doesn't mean that it's a right fit for all countries. Although the United States have attempted many times to create a change concerning healthcare in this country, the history of the country, the socioeconomic status of citizens would choose who would pay for the healthcare, and the plan to ensure healthcare for all through a change of allocations of government spending in the United States is very important when considering implementing a healthcare system. Although the United States have been on the edge of deciding a universal healthcare for the United States for ages, there have been examples of other countries having been able to provide healthcare for their citizens very easily. Due to the politics of the United States, it was hard throughout history to officially have this. According to the PNHP, or Physicians for the National Health Program, it states that during the Progressive era, President Theodore Roosevelt was in power, and although he supported health insurance because he believed that no country would be strong with whose people were sick and poor, most of the initiatives for reform took place outside the government, which was the main starting point for healthcare to take its place. This was troubling due to the working class not being able to have any health care that would help them continue working, because if the working class people were either sick or stressed, they wouldn't be able to help out with the economy, help work their jobs in order to feed their family, or keep a roof over their head. Most people who lived in poor areas would be inflicted by this. If there's no one working, then the economy would dwindle after that. In response to this, Theodore Roosevelt in 1906 led a campaign with the Association of Labor Legislation, led the campaign for health insurance. There were many services included, such as physicians, nurses, and hospitals, sick pay, maternity leaves, and death benefits. The downfall of this movement was when World War I began and many people were beginning to become anti-German, and having a universal health care was mostly implied with European countries due to them having already had a universal healthcare system. And with this, America tried to push anything out that was German and stick with the American values. In the end, they state that political naivety on the part of the reformers in failing to deal with the interest group opposition ideology, historical experience, and the overall political context all played a role in shaping how these groups identified with the healthcare system. This is controversial because having a healthcare system, having a universal healthcare is considered a human right. Due to history, it had set the country back a few years behind other first world countries. Some inherent issues were due to the scare of World War I had kept keeping the large portion of the U.S. being poor and middle class from obtaining the health care that they need. The government kept their mind on political situations and not on the people of the United States. I believe that the United States has created a ploy during history in order to have the poor people in the United States oppressed due to their lack of health care, and have them struggle more at helping their family with shelter, food, and etc. Even though history played a large part of the healthcare system in America, it is important to state that the government also paid attention to those in different socioeconomic statuses. According to the balance, they state both the disadvantages and advantages of having a universal healthcare system. Some of the advantages being lower healthcare costs and administrative costs, early childhood care, and imposed taxes and regulations towards healthcare choices. Some of the disadvantages are having to pay for other people's medical care, people having less financial incentives to stay healthy, and others. Although neither the advantages or disadvantage outweigh the others, it is important that the country decides what is best for the citizens. And since the U.S. is known for being a very prominently capitalist country, it is known for them to side with the politically powerful and the rich. And this is controversial because it means that the richest lives are outweighing those who are poor and working hard for this country. And it's also controversial due to them outweighing a human life with another. I believe that there are other ways to allocate these funds, and the government is using their funds for other programs that are not as important then as the lives of the citizens of the United States. To make sure that we go around the controversial social issues of universal healthcare, I believe it's important to create a policy to ensure healthcare for all. This makes sure that those who cannot have healthcare are ensured to have a form of healthcare at arm's reach. This ensures that private insurers could still exist for those who would still like to have care from private insurers, but it gives an option that will have the government step in and help out other people. According to the World Health Organization, they say universal health coverage has a direct impact on population's health and welfare. It is a factor that pushes people to do their daily jobs every day that keeps this country running. Some inherent issues from this might be ensuring fee healthcare it costs a lot to save a person's life, and with that, I know how some people would question, why is my money going towards another person's life, and I'm perfectly healthy. I could use that money for something else. But I believe that even though it's hard to think where your money is going these days, I also believe that it's important to have the health of the people insured first and then money. Although universal health care is a hard concept for Americans to think about, it is important to insert in our daily lives to ensure the health and care of people's lives are living. Without it, we would not be able to run this country with help from the majority of the country, which is mostly middle to lower class. This is controversial due to the cost of having a universal healthcare system, but I believe it would be worth it in the long run. Thank you.